With our friends at the GRMC, we're always happy to present to you on the second Tuesday of every month your healthcare partner. And thank you, Cindy Hansen, for the hookup from Guam Regional Medical City. And I am so happy to introduce to you Dr. Edna Acuna. Thank you very much for coming. Dr. Edna Acuna. And Melliza Young, who's been here before.
Yes.
And how are you?
I'm good. Glad to be here again.
I'm so glad. You are the Patient Education Manager for Guam Regional Medical City. So, I know that the focus today is on a month that we are commemorating, and which is National Diabetes Month. And all over Guam, they had a big conference happening this weekend with the Guam Diabetes Association, and a conference that drew some off-island visitors and a lot of conversation about, you know, there's so much about the disease of diabetes that and depending on where a person is in their in the care of themselves once they've been diagnosed, different symptoms can accompany. Yes. And so part of the opportunity is to sort of tell people who either have diabetes where they are in, because again, so much of it is untreated. Diabetes is untreated. So, Dr. Acuna, thank you for coming here today, and I appreciate your time.
Thank you.
You specialize in a disease that so many people have in Guam.
Well,
is it a specialty anymore when so many people have it?
No. Usually the physician who takes care of diabetes are called endocrinologist or diabetologist. Mm-hmm. I'm not a primary care physician. My primary specialty was anesthesia. It's way out of on the left field.
No,
anyway,
absolutely. But a part of that is wound care.
No, this is a specialty that I took after I retired from anesthesia.
Okay.
And so this is actually a new dynamic specialty that just started maybe about 3 decades ago. Mm-hmm. And so after my retirement, I was encouraged to take up the specialty of wound care.
Oh, so you had like the other life. Now
yes.
You've expanded your life.
Correct.
For so many more years.
Yes.
Well, so this is a subspecialty, but is it true that? Is it true or is it not true that you are bound at some point in the care of diabetes? Or
yes, for sure, because the majority of wounds that I see are diabetic ulcers. Mm. And the reason why I am here in Guam is because I had a serendipitous conversation with the former governor several years ago who told me that I was here vacationing, and he told me that there's a big need for wound specialists in this island, as diabetes is really wreaking havoc on his people. So that planted a seed in my mind, and came to Guam. Before I came, there was no wound care clinic in Guam at all. And the go-to solution for wounds, chronic wounds that would not heal, is always amputation.
Really?
Yes.
And so, you could look at that and say that could be avoidable.
Yes, definitely.
Is that the last stop is for you is amputation?
Correct.
Yeah.
Correct. So
were we doing them unnecessarily on the island because we had no other options to treat?
No. Amputations are done after the physician really treats the patient for several months or several years where they don't see any signs of progression of healing.
I see.
And, everybody gets frustrated, both the patient and the clinician themselves. And so there's no availability of wound care supplies here in the island. No clinic where patients can really access specialized wound care management.
And where does that start? Is it after you notice there is an ulcer, or when does the care usually? You have to closely monitor.
Correct. That's a very good question. The time when a physician or a clinician sees that the wound does not show any sign of healing within the first 2 weeks, and also there's just no healing after 30 days, then that's the time to call for a wound care specialist.
And so what would you be providing that a regular physician just trying to treat a wound would provide? Is it, I mean, whatever the course would be, antibiotics or whatever
Right.
it is, what?
The wound care clinic was established so that people can really have that access for specialized wound care management. And the main goals are, of course, healing of the wound, preventing complications, and restoring quality of life. In order to do that, we follow certain algorithms in the diagnosis of a wound. So it's really a very focused attention on the wound itself, because the basic thing here is the poor knowledge of why chronic wounds just don't heal. And this is what we are bringing into the island. So,
Are we talking about like a wound, something might subside and then pop up again? Or is that what chronic means? It's
Yes.
like it looks like it's healed and then it pops up again.
correct.
I see.
Also, there's a common knowledge that if a wound scabs, that means it's healing, which is a wrong perception. And then, the culture that I saw here in Guam within the last 4 years that I'm here is that there's a pervasive thinking that wounds just won't heal no matter what you do to it. So most of the time, these people are told to go to the sea and dip their wounds because it will clean their wounds, which is very, very wrong.
Isn't there a lot of bacteria in the sea?
There's a lot of potent bacteria in the sea. Yes.
That would be the last place I would want to go. Somebody told me to go dip my open wound in the ocean. But point well taken. So there are some old wives' tales on how.
Correct.
And it doesn't. Are there not? Maybe you can answer this because you talk to patients and they're old wives' tales, right? I mean, they think that anytime you get bit by anything in the ocean, you're supposed to urinate on it.
I've heard that too.
You've heard that. That must make you just go roll your eyes. But there are some of these though deep beliefs. Don't you agree? Like, go ahead and tell me
That's
what you're.
true. So, what I do in the hospital as a certified diabetes educator is we explore what are the cultural beliefs that our patients have that can affect the treatment plan. And so that's fairly common what we hear of patients dipping it in the sea or wrapping it with some sort
Herbs.
of leaves.
Yeah,
Yes, that
herbs.
they get from their backyard. And some other belief is that it's brought about by witchcraft or other people meaning harm to them. And
Would you ever put a leech on it?
Not
No.
on diabetes.
Okay. Sorry. Go ahead. I was distracted by
Yeah.
that moment. Okay.
No, but it's fairly common, and we don't laugh at it when we hear it from patients because
No.
it's true for them.
They believe
and-
it, sure.
Exactly, and this is where our role comes in on trying to explain to them how their diabetes really affects how they control their diabetes affects the healing of their wound or other complications they may have, like say their risk for heart attack or for kidney failure.
Okay.
Yeah.
So that there are other byproducts, sidelined symptoms. I mean, issues that could be complicate it. But and in the end, it you have to promote, sterility, right? You have to promote that. You can't. That is the one. If there's a factor that's going to heal a wound, it would be doing so with using sterile medicines and sterile, applications and that sort of thing. Is that what it comes?
Not strictly, because chronic wounds are really colonized with bacteria. That's normal. So what is important is how you put your medications and how you start treating your medications with antibiotics or topical antiseptics.
Okay.
What is common here is the use of betadine, hydrogen peroxide, vinegar solutions, those things. Those are things that you can use for a short period of time. But again,
We're
there's
talking
a lot
about-
of problems.
We're
with
talking
that.
about ulcers that have developed because of diabetes, and so
Correct.
introduce the hyperbaric chamber.
Yes.
Okay, so the hyperbaric chamber provides what layer of
Healing?
care? Yeah.
Yes.
wound.
We provide the hyperbaric medicine as towards the end of like a 30-day conservative treatment of wounds. Okay, most diabetics when they come to us, have already been treated by other physicians.
Okay.
So we consider that part of the 30-day period. So after 30 days, we try to qualify them for the advanced modality treatment, which is hyperbaric medicine. And so we use the hyperbaric chamber that we have over at GRMC for helping treat diabetic ulcers.
What can you tell me what the science is on that? What exactly does that do?
What it does is we have what's called the monoplace chamber, where one patient stays in the chamber, compared to the multi-place chamber that they have in the Navy. The Navy has a big chamber where they use it for diving accidents, mostly. Over at GRMC, we have 2 monoplace chambers where we can put one patient in each chamber. What it does is that we put them under 100% oxygen under pressure. So oxygen acts as a medicine. So you take it in and you breathe it in, and then it goes into your systemic circulation, and then it goes to the area where you need oxygen to heal the wound.
Simple as that.
Simple as that.
Simple as
Correct.
that. But this is sort of advanced.
Correct.
I mean, and it does continue to advance. What are the dangers of hyperbaric medicine?
Yes, the dangers are because oxygen is given under pressure. A patient who has like lung problems, if you have like congestive heart failure or pulmonary edema where you have fluid in your lungs, with the increasing pressure that you take, it could end into a burst lung,
wow.
So that's one. And people who are smokers, for instance, smokers usually have this air sacs that are big, the simple term. And then what it does, under pressure, it could pop and can cause tension pneumothorax.
All right.
And so those are some. And then if you breathe in a lot of oxygen, 100%, you'll always have that problem with toxicity, oxygen toxicity.
Okay.
Seizures, etc.
Yeah. And so is that a last resort sort of care or healing? Is that a last resort, or where in the process would you recommend that?
I would recommend that if I see that the wound is not healing conservatively within the next 2 weeks, the following 2 weeks that I'm seeing a patient, I don't see any signs of healing, and he's qualified for hyperbarics, I start hyperbarics right away.
It just seems so much easier than hyperbaric medicine from the past, because like you said, the Navy was the only place on Guam that had the chamber. And like you said, it was a huge chamber, and there was a lot of people in it. I mean, the potential for a lot of people to be in it at the same time. So, having this advancement at GRMC is, I think, is a pretty big deal for Guam. Let me get Rodney, if you don't mind putting on your headphones, Dr. Acuna, and then you can hear what Rodney has to say. This is the knob that controls the volume, this silver one, so you can go higher or lower. And here's Rodney. Hi, Rodney.
Good morning.
Good morning. Good morning, Rodney.
Good morning.
I have a question. I'm a diabetic, and I told my friend to listen to the topic right now. I'm not sure if he's listening, but when I check my blood sugar, I check it through my fingers. He tells me that he's a diabetic also, and he tells me he checks his blood sugar on his feet, just because he wants to know that he still has feelings on his feet. But I advise him not to do it on his feet, on his fingers. The only reason he does that is because he wants to know that he still has feelings on his feet. Is it advisable to check your blood sugar and poke your feet just to check your blood sugar?
Dr. Acuna, is it advisable to check your blood sugar through the feet?
No, I don't think so. I'm not a diabetologist, but it would be best to just go ahead and do it in your hand, because it's easier to clean it, get a good sample. The feet has thick skin; it's very difficult to poke it. Even if you don't have any feeling in that feet, you may not be able to get a good sample of blood to check your blood sugar. So
Yeah, and then the feet are also exposed to a lot more germs than your hands might be, or fingers might be. It's easier, harder to wash, or I don't know. Anyway, no feet. Rodney, no feet.
And I hope he's listening, because I did let him know it's better to do it on your hands than your feet. And like what I said, he told me that the only reason he takes it to his feet is because he still wants to know if he has feelings on his feet.
Oh, that's
But
a
I
good.
told him you're more
That's a
prone
good
to
point.
Get
But
an infection because your feet, it's harder
because
to,
they can't feel anything.
heal.
Maybe he
Yeah.
should talk to. Yeah, go ahead, Cindy. You wanted to advise him on something.
Rodney. Hi, Rodney. This is Cindy from GRMC.
Hi, Cindy.
Hi. I'm also a diabetic, and I often check my feet too. I worry as well. Your friend probably makes regular visits, I would think, at least every 3 months. I'm sure he has to get his blood checked because I do as part of my diabetic care.
Yes,
And
yeah.
he should be checking with his doctor if he has concerns about his feet. I know for myself, I experience, especially in the evening, that my feet get cold. And I am always having my son touch them. Do my feet feel cold? And they never do. And I've had my doctor tell me that that actually is a symptom of my diabetes. So I would recommend that your friend just check with his primary caregiver if he has concerns about his feet, rather than poking his feet with with his needle.
Tell him to get the right advice from his primary caregiver, Rodney.
Okay.
Thanks a lot for the call, brother. It's nice to hear your voice.
Thank you, Patty. Have a good one, everyone.
My pleasure. Now, are you the only wound care physician on Guam at present?
At the present time, that's what I was. I think there are maybe a couple over
Okay.
at GMH.
Okay.
But as far as credentials are concerned, I am the only one that I know that has the hyperbaric chamber in this island.
I see. Well, this is good information to know. This again is information that we try to pass on, not only to people who have diabetes, but for those who are fighting off. Sometimes when you hear these stories, it's enough for you to turn your life around, or at least compel you to go to the doctor to get some, just a total review of your health and see where you are.
That's correct.
Yeah. Doctor, it's nice to meet you. Thank you very much.
Nice to meet you too, Patty.
It's fun, and thank you, Ms. Young, again for coming. I'm sure we'll have a fourth time because this is your healthcare partner. These are our friends from the Guam Regional Medical City.